Nice to meet you.
Nice to meet you.
So you today came here for the refractive surgery, right?
Yes.
So we did a lot of examination for your eyes. Three things is most important when we do the refractive surgery. The first is your refractive error. And the second thing is we do the laser surgery on your cornea.
Yep.
So the cornea shape and the thickness is very important. And third thing is your eye condition.
Yep.
The vessels and nerves condition will be important. So on base of these three, I will recommend the best option is refractive surgery. So have you ever had any this kind of examination before?
No, never.
This is your first time?
Yeah.
So let's check your results. I will show you on this video screen. Okay, so you have very high myopia
Yeah.
and high astigmatism.
Yeah.
Very high than the average of the other people.
Okay.
Okay, your eyes is all good. And the good news is you have very thick cornea.
Okay.
And that means you can do any kind of refractive surgery. Which I will recommend you is the Clear Lasik. It's based on the SMILE method. So we just make a 2mm incision on your cornea. And with using the femtosecond laser, we'll make a lenticular inside the cornea. And we'll take out the lenticular just by the 2mm incision. So all your epithelium and skin will be remained. So it's very safe.
Okay.
And from next day, you can just go back to your lifestyle. About 1 to 2 weeks, you will feel a little bit of blurry vision. It will be better when they pass. So after 3 months, you will almost perfect clear visions.
Yeah, that's good.
I will check your eyes. So any questions about the surgery or your eye?
My eyelashes, sometimes they poke a little.
Yes, because the position of your eyelash is
Yeah.
like going down.
Yeah.
So sometimes it scratches your eyes and makes your eyes dry.
But it won't affect the healing.
Because I told you before, your epithelium skin will be just remain as usually, so it will be safe. Okay, this time will be his last time with the glasses.
Yeah. Last time.
Okay, so other cautions and other information we'll give you at the consultations. Then I will check your eyes before the surgery one more time, and then I'll see you at the operation.
I didn't expect to be able to get this many options. I went to one exam in Germany, and they basically told me no, I won't be able to get either LASIK or any other type other than like implants. Always good to get a second opinion. Best to do it here.
As the doctor explained, you can get all three kind of possible surgeries, and we recommend you the Clear Lasik. So these are the basically consent forms that you have before the surgery, as well as the precautions on how to take the prescribed medication afterwards. So the purpose of the whole surgery is basically to see without any glasses or lenses. They really use the second laser to create a small hole just around 2 millimeters, and then they're going to correct the vision with that. So with any surgery, there might be possible side effects, or there might be irritation, dryness, sensitivity with the light as well, possibly. So in your case, your cornea is quite thick, so the possible chances of revision is not really high, but if in case you're needed, you can get revision surgery. So during the surgery, in rare cases, it can happen that the doctor decides to use the LASIK blade, which means flap the surface and then use the exam laser to basically correct the vision. From the distance, you will have a better see, but maybe from close up, you will have some problems with the view. So during 1, 2, 3 weeks after the surgery, you might have some blurry vision from time to time, like it can come and go. The vision number is quite normal. And if that's the case, all you have to do is just take the prescribed medication and it should go away naturally. So you might have also some sensitivity to the lights. So all you have to do basically is just take the eye drops regularly. It's also, of course, to take the moisturized eye drops afterwards. So in case there is any abnormality, please let us know. You don't need to worry. I still have to explain it to you just in case. So of course, they're going to try their best to get your vision in 2020, but with my So regarding the precautions and the after effects, you might have some dryness than average, and some people experience for up to 2 years, but usually it can be less. During the winter, you have to keep in mind your eyes will be more dry than normal, so just make sure to put the eye drops. In case there are any problems through surgery, like possible revision cases might be possible afterwards. Just during the 23 months, when you get the correction, you can come in here and you get the checkup, but afterwards there might be additional charges. So please put the date on, your date of birth, your name, and the signature, please. So afterwards, you should not rub your eyes. That's quite important. And what I would recommend for today after surgery to rest at home. Now in winter even, and after the surgery, your eyes can be dry on average. So just make sure to put the eyebrows in. And she says instead of having like a big amount at once, just from time to time. So it's recommended to wear the glasses, sunglasses for 1 month after surgery. So you can wash your face from the next day on.
Okay.
So you can start from the next day your daily routine, but you just have to keep in mind not to have it in your eyes if possible. For example, if you're doing any eye like makeup or anything else. So you can technically start working out from tomorrow on, but you should try to avoid any sports.
So I can go skiing, right?
We say around 1 month you should try to stay away from any danger. But if you do it, which you can technically, you should make sure to wear the goggles and protect your eyes as much as possible. So yes, you can get a perm from tomorrow on or color your hair if you want. And also try to avoid drinking alcohol for 1 week as well as riding in car. Usually they give protective goggles, but in the case for the Smile one, it is not necessary. So you're gonna get these prescribed, and these one you have to take 4 times a day. So during the morning, midday, evening, and before you sleep. You can use it for a whole month, and when you use it, you should wait like 1-2 minutes after you use the second one. So this one is basically to avoid the dryness, and you can use it as much as you want. So you will have these kind of drops. For these drops, this will be the form, and for this medication specifically, you should use it in the morning and evening to prevent the dryness, and like one thing every day. So morning and evening. And for this one, you can just close it and open whenever you want.
Okay.